Hemophilia is an inherited bleeding disorder that impairs the body's ability to make clots. If you're suffering from hemophilia, you may bleed for a longer time, which calls for special attention. Hemophilia is a deficiency of clotting factors that result in prolonged bleeding. In such cases, it is important to take necessary precautions. On this World Hemophilia Day, we are speaking to eminent doctors and hematologists to create awareness about hemophilia disorders and their necessary precautionary measures. Hi, I'm Sana Khan, and today in this initiative, we are speaking to Dr. Shweta Bansal. Dr. Shweta Bansal has been an active member of Pediatric Hematology Oncology Society of India and has served as its treasurer for 4 years. Recently, she has been appointed as an ethics committee member of the prestigious Indian Council of Medical Research. She has also served as an editor-in-chief and assistant editor at various PubMed Index journals, including South Asian Journal of Cancer, Pediatric Hematology Oncology Journal. She has received accolades for her work and presentations at national and international conferences, including St. Jude Viva 2010 and SIOP 2008. She has been facilitated by Society of Oncology, Patna, for her outstanding work in field of pediatric oncology in 2010. Please welcome Dr. Shweta for coming to our show. Hello, ma'am. Welcome to Medicircle. How are you?
Yeah, fine. Thank you, Sana, for a very kind introduction. Happy to be here on this space to create awareness about hemophilia.
Thank you so much. Our pleasure. Okay, Dr. Shweta, what causes hemophilia?
So, Sana, as you said in your introduction, that hemophilia is a clotting disorder. Mm-hmm. So, for layman person to understand what is clotting disorder means. So, hemophilia is a bleeding disorder in which the blood doesn't clot. You know, in our body, the blood remains in the fluid or in the flowing state because it has to carry a lot of nutrients and oxygen to various tissues of the body.
Right.
But whenever the vessel has a breach or any injury, then the blood starts coming out of it. Now here the process of clotting happens. So our body wants to save each and every drop of the blood. It doesn't want to get it wasted. Okay.
Right.
So the various processes and the mechanisms and the various factors which are present in the blood, they come into play and they prevent the blood from getting out from the vessel and prevent the wastage of the blood. So that process is known as a clotting process. Okay. And there are various steps or various factors which are involved in this clotting process. And hemophilia is a specific disorder in which there is a deficiency of particular factors, and the person who is having a deficiency of these clotting factors can have hemophilia. So we have two types of hemophilia. One is hemophilia A and another is hemophilia B. So hemophilia is the deficiency of factor 8 and hemophilia B is the deficiency of factor 9. So this is a hemophilia disorder.
Ma'am, what are the signs and symptoms of it?
Yeah. So understanding hemophilia, it is very important to understand the various signs and symptoms of hemophilia. It can vary from person to person. One is that we categorize hemophilia into mild, moderate and severe category. Depending upon what is the percentage of the clotting factor which is present in the person. If he is very deficient, so normal quantity of the clotting factor in a person's body ranges from 50% to 150%. That is a normal range, which helps in clotting the blood. If he is deficient, if it is less than 1% of the clotting factor, then we call it as a severe hemophilia. And then those patients have a severe symptoms. If the person is having a 1 to 5% of the clotting factor deficiency, then it comes into the category of moderate hemophilia. And those who are having a factor deficiency between 5 to 50%, they considered as a mild hemophilia. Okay. So the major signs and symptoms for these patients is like, especially for the severe hemophilia, they have a spontaneous bleeding. So even if you're sitting at some place, you are lying on the bed also, you can bleed anytime.
Okay.
At any point. So mostly they have a bleeding in the joints, in the deep tissues. They can have a GI bleeding. They can bleed in any part of the body. Okay. It mainly happens in the boys because this is an X-linked recessive disease. It means that the X chromosome carries this abnormal gene.
Okay.
So as you know that the females, they have 2 X chromosomes. So if one X chromosome is not working properly, the second X chromosome takes over. And that's why females, they don't have this disorder until unless they have some disorder like Turner syndrome, only one X chromosome is present.
Okay.
While boys, they have only one X chromosome, and other is the Y chromosome. So if there is an abnormality in a single X chromosome, they manifest this disorder. So that's why you see mainly this disorder in the males. Okay. And we have seen the children who have undergone circumcision at early age, and if they have a hemophilia, they bleed very significantly. So this is the presenting symptoms in many or most % of the cases. Okay. So intracranial bleed happens in only 1 to 2% of the patients. Circumcision is the major presenting symptom of these patients, and they can bleed in the joints also. And these are the things. So any abnormal bleeding, if you see in a child, then that needs an investigation. And from that investigation, we can diagnose whether the patient is having the clotting factor deficiency or some other problem is there.
Right. Ma'am, how is the diagnosis done for hemophilia?
Yeah. So hemophilia diagnosis is not very difficult. Very easily available tests are there. So first of all, any child who's having a bleeding abnormality, it means that he's bleeding more than any normal child, that needs to be investigated. So we do a bleeding scoring for these patients. Then we take a proper family history of these patients. As I said, mostly this happens in the males, not in the females. So if you take a history that the mostly the maternal uncles, they are affected with it, or the mother's sons are affected with it, or the sister's brother are affected with it. So from that you can make out this is an X-linked recessive disorder. So one is the history is very, very important in this. Then the severity of the bleeding we need to see. And third is that we do a blood test. So in the blood test, we do some very simple blood tests like complete blood count. We do a prothrombin time. We do APTT, which is activated prothromboplastin time. And then we do a fibrinogen test. So if all tests are normal except the APTT, then we know that there is some factor deficiency. So if your ability comes prolonged, what we do is that we mix it with the normal plasma of the person. And if it gets normalized completely, it means that there is a factor deficiency. And then we check the factor levels by another test. And from there, we know whether it is a mild, moderate, or severe hemophilia.
Okay. Dr. Shweta, how severe can hemophilia be?
Yeah. So as I said earlier, it depends upon the percentage of the clotting factor which is present. Right. If you have less than 1% of the clotting factor in your body, it can be very severe. The person can lead to death also. So it can be a major problem. Okay, so they can have a bleeding in their joints. They can have a bleeding in their deep tissues. They can have a bleeding in their gastrointestinal tract. They can have a bleeding in their, they can have an intracranial bleeding also. So they can have a bleeding anywhere in their body. While in cases of mild hemophilia, they don't bleed spontaneously, and they bleed only if there is some injury or there is some surgeries done to them. So those patients who have undergone some surgery, they can bleed. So diagnosing a hemophilia is very, very important. And the treatment is easy. We can do a replacement factor for these patients and definitely prevent severe bleeding in these patients.
Thank you so much, Dr. Shweta, for coming to our show and sharing your valuable and significant information with all our viewers today. Thank you so much. It was a pleasure having you on the show.